this birthday celebration means a lot. And thank you so much. I'm very, very happy. Vielen Dank. And thank you to you and also to my brother, Minister Karl.
Thank you. So, Dr. Tedros, do share with us some of your reflections in relation to the 75th anniversary as the opening remarks here at this event. Please, over to you.
Thank you, thank you. Thank you again. Thank you, Ilona. Very glad to join you. My brother, Minister Karl, and dear colleagues and friends, greetings from Manila again. And apologies, I can't be with you in person today. Of course, originally a video was proposed, but I prefer to at least virtually be with you because this is really a special occasion you organized for WHO. So I wanted to join you virtually. There was actually a discussion based on my speech and the RD's presentation. And I will be back immediately in order to address the questions from member states. So I hope you will excuse me if I leave as soon as I speak. And we, as you know, we meet in troubling times, in a troubled world, a time of conflict and crisis, when the fabric of multilateralism is frayed and its very future is questioned. And yet, this is a time that shows why cooperation between countries is so important and why a forum like the World Health Summit is so important for bringing people together from around the world to find shared solutions to shared health threats. Indeed, it was in the aftermath of the Second World War that the nations of the world came together to form the United Nations and the World Health Organization. They recognized that the only alternative to global conflict was global cooperation. In 1948, the world has achieved great gains in public health. Average life expectancy globally has increased from 46 to 73 years, with the biggest gains in the poorest countries. The ancient scourge of smallpox has been eradicated, and the world is on the verge of eradicating polio. 42 countries have eliminated malaria. In the past 20 years, the global smoking rate has fallen by 1/3, and rates of maternal and infant mortality have halved. The list goes on, but we still face enormous challenges, some old, some new. We continue to face vast inequities in access to health services between and within countries. COVID-19 has exposed major gaps in the world's defenses against epidemics, pandemics, and other health emergencies. And the health of billions of people is under threat from conflict, air pollution, and the climate crisis, and aggressively marketed products that harm health. All these challenges show why the world needs a strong WHO now more than ever. WHO faces its own challenges. The world's expectations of WHO have increased substantially, but our resources have not. The global health architecture has become more complex, and increasingly we face the challenge of being a technical organization operating in a political and politicized world. 75 years since our founding, WHO remains central to the global health architecture as the only international health organization that's representative of all countries and governed by countries. WHO is the world's health organization, the place where countries come together to find shared solutions to shared threats. That's why today and every day, WHO will keep working with countries and communities all over the world in pursuit of our founding vision, the highest possible standard of health for all people. And I hope during the session you will sing happy birthday to WHO. We were saying in one event, people started saying happy birthday to who? Then people started to look at each other and say who? Happy birthday to who? And then who?
Thank you. So, and I suggest as a thank you to Dr. Tedros, we start singing straight away. Happy birthday to you. Happy birthday to you. I'm not such a good singer. Happy birthday, dear WHO. Happy birthday to you. So thank you for being with us.
Thank you. Thank you very much indeed. Thank you. Thank you, Germany. Vielen Dank.
Vielen Dank zurück an dich.
Gesundheit ist ein Menschenrecht.
Yay!
Thank you.
The most important German sentence that we have taught Dr. Tedros. Gesundheit ist ein Menschenrecht. Thank you. So, thank you very much for that. And of course, the Director General alluded to the very difficult times. We discussed some of these issues also yesterday. But this is in a way nothing new for WHO. WHO has continued to work during the Cold War, during a whole range of very significant conflicts, during a range of political tensions. And as you all know, it's an incredible balancing act. And there's a lot of things written in political science and elsewhere